Patrick Honour.
Good morning, my lady. Our witness today is Sir Patrick Vallance.
I do solemnly, sincerely and truly declare and affirm that the evidence I shall give shall be the truth, the whole truth, and nothing but the truth.
Sir Patrick, I'm sorry the modular structure of this inquiry means we have to keep imposing on you.
I suspect this is not the last time.
I fear not.
Could you give us your full name, please?
Yes, Patrick John Thompson Vallance.
Sir Patrick, as my lady has just indicated, this is not your first visit to give evidence to the inquiry. You prepared a witness statement for the first module of this inquiry, which we see on screen now. And for completeness, it's also right, isn't it, that you gave oral evidence to Module 1 of the inquiry on the 22nd of June of this year?
Yes.
And the transcript of that evidence is, of course, available on the inquiry website. You kindly have prepared two further witness statements at the request of this module, Module 2 of the inquiry. First of all, a lengthy statement which we see the first page of which on the screen now. That is a statement that runs to over 200 pages, and we will be looking in some detail at it today. It's signed by you on the last page of that statement, and we can see from this page that it's dated, or indeed from the last page as well, that it's dated the 14th of August of this year. Are the contents of that statement true to the best of your knowledge and belief?
Yes, they are.
Thank you. More recently, you have prepared a short further statement for us. It's, as we see, the third statement on the screen now. That is dated on the top there, the 14th of November, only a few weeks ago. Is that statement also true to the best of your knowledge and belief?
Yes, it is.
Thank you. Sir Patrick, very briefly, a few questions about your career. It's right, isn't it, that your initial training was as a medical doctor. You then spent some time practicing as a general physician in NHS hospitals in London. Is that right?
Yes, I was at University College London and St George's Hospital London.
After that, your career took an academic turn, and in the 1990s and early 2000s, you spent some time first as a senior lecturer and then as a professor of clinical pharmacology, again at UCL.
I was professor of medicine at UCL, and I continued to practice during that period as well.
Yes. So I was going to say, during that period, you were a consultant physician.
Yes.
At various UCL hospitals.
Yes.
And then in 2006, your career took another turn, and you spent from 2006 to 2018 working for GlaxoSmithKline.
Yes, I was global president of research and development for them.
And this, of course, is the period with which we're most concerned. In April 2018, your career took another turn, and you were appointed on that date as Government Chief Scientific Advisor, and you remained in that post until March of this year.
Yes.
And when you left that post in March, you were succeeded, is this right, by Dame Angela McLean, who the inquiry will be hearing from in due course.
Yes.
Let me, again, by way of sort of preliminary matters, ask you about two further documents, Sir Patrick, beyond your witness statements. And the first of those is the technical report. We have it on page now. We see the first page. It's described as a technical report for future UK medical officers, government chief scientific advisors, national medical directors, public health leaders in a pandemic. We can see that it was dated December of last year. And it's right, isn't it? I don't think we need to look at this, but you were one of a series of authors of this document, the other authors including Sir Chris Whitty, the Chief Medical Officer, and other his deputies and others. Is that right?
The chapters were all written by different experts, and Sir Chris and I and the other deputy medical officers and medical officers from the devolved administration acted as sort of an editorial team to try and make sure that we ended up with a finished product that we thought would be useful.
We may go to certain passages within this document as we go through matters today, but with that title in mind, can you just expand on that slightly and give us an idea of what the purpose of this document was?
The purpose of this document was to try to understand a few things about what had happened during the current pandemic from a technical perspective, and to try to draw from that and other evidence what useful things might be for a future, as it says, chief medical officer, chief scientific advisor or others, to be able to look at it and say, well, there are some things there that we need to take notice of. So some of them are recommendations about what should be put in place now in order to make sure that you get the preparedness and the structures right. And some of them are things that we think would be useful for people to look at, should there, which I'm afraid there will be at some point, be another pandemic. Not because you can predict what that pandemic would look like, because each one will be different, but there are some generic lessons in there that we thought would be helpful for people to understand.
Yeah. So this document, if you like, sits alongside your witness evidence as drawing on some very similar themes.
It does.
Thank you. Let me move on to a different set of documents by way of introduction, and that is the evening notes that the inquiry has already heard something about. And it's right, Sir Patrick, isn't it, that in response to a disclosure request made by this inquiry, you produced a lengthy set of personal notes that you wrote during the pandemic. You produced them to us. And just to be clear about this, although those notes contained some very sensitive personal entries, you disclosed the notes in full to the inquiry, as it were, at the first time of asking.
Yes, I did.
You describe something about those notes in your witness statement, and I wonder if we can go to paragraph 474, please, on page 157. And you describe here, Sir Patrick, that your practice of writing these notes started as a means essentially of protecting your own mental health, given the stress that you were experiencing on a daily basis. You wrote them, the term has been used as something of a brain dump at the end of each day. Is that right?
Yes, at the end of each day, often quite late in the evening, I would just spend a few minutes jotting down some thoughts from that day, some things and reflections, and did it as a way to get that, in a sense, out of the way so that I could concentrate on the following day. These were private thoughts. They were instant reflections from a day, and once they were written, I actually never looked at them again. I mean, they were put in a drawer, and that was that. And I certainly had no intention of doing anything else with them either.
Just on that last point, no intention to publish them or use them as a basis. We've seen various people who were involved in the pandemic, including some of your scientific colleagues, have written memoirs or accounts of their time. Did you think you might draw on these notes?
I had no intention whatsoever of these ever seeing the light of day or me looking at them again, and I sort of felt the world had probably had enough of books of reflections of people's thoughts during COVID.
If we can go over the page, please. At paragraph 478, so that's the bottom of the next page, you make the point, you've already said these notes were written quickly at the end of the day, but you then add that perhaps obvious point, that they weren't intended, they couldn't perhaps have been a considered analysis of events. Reading on, you say you've never gone back to them, you didn't edit them, you didn't, as it were, add to these thoughts things that happened later or any further reflections. Are those important matters that we need to bear in mind when, as we will, we look at some of those notes?
I think they are. I mean, from my perspective, these were a way of just decompressing at the end of a day, and they were some thoughts I'd had that day, and wrote down that day, as I say, in order to be clearer the following day that I was going to concentrate on the following day. And they had no purpose other than that. And nobody, including members of my family or anyone, had seen them or I had any intention of showing them to anybody.
You've obviously, much more recently, in the last weeks and months, looked back at many of those notes. Would it be fair to say, then, that some of them, some of the notes you made, reflect thoughts which you still think, in fact, are accurate, and perhaps others you would wish to qualify or even disown?
Yes, I mean, some of it I look back and think, well, that seems like a sort of sensible series of reflections over that period. Others I look back and I can see I might have written something one day and then 2 days later written something that said, actually, I don't agree with myself on that, which may have been how somebody had behaved or somebody had made an observation. So they were very much instant thoughts.
And we will bear all those things in mind when, as we look at some of these notes later today. May I just ask a rather practical point about these notes? I think there's at least one section of the notes which actually are notes that you took during a meeting, the meeting of the 20th of September with Professor Gupta and others. But by and large, as you've said, is this right? You remembered things that took place during the day and then wrote about them in the evening?
Yeah, I might have scribbled the occasional thing down on a bit of paper during the day and then looked at it in the evening. But they were a mix of things I might have noted at the time and things that I noted in the evening. And as I'm sure you've had the pleasure of realising, my handwriting is not exactly excellent.
Well,
You're a doctor, Sir Patrick.
I know.
I'm glad to say that is a task that others in our team have had to grapple with, Sir Patrick. But I just wanted to pick up the point you made about making notes during the day, because when we look at the notes, we see that quite often there are direct quotations that people who you're in meetings with said. Might that then be something that you made a note about at the time and then put into your notes later, or would that just be your best memory later in the day of what they'd said?
It could have been either of those things, and I might have just jotted down the quotation on a bit of paper during the day.
You've mentioned your handwriting, Sir Patrick, and just for clarity, in terms of the process, you provided us, didn't you, with your manuscript notes, the originals that you wrote. Those have then been transcribed into a typed version. And a further exercise has taken place to capture certain excerpts which have been put into a schedule. And during the course of today, we will be looking mainly at the schedule of excerpts and a little bit at the transcript, but happily not at the manuscript version at all. I'm going to move on and again, by way of introduction, ask you something about your role as Chief Scientific Advisor before the pandemic, in peacetime, if you like. We've heard that you were appointed in April 2018, and one assumes that the first year and 3/4 or so of your term was very different from the latter period.
Yes, it was.
You have set out in your first witness statement for Module 1 a degree of detail about all the things that the role of Government Chief Scientific Advisor entails. And I'm not going to go to that statement in any detail, but it is apparent from that statement that there is far more to that role than the fairly narrow function, very important function, but fairly narrow function that you performed during the pandemic. Can you, in a few sentences, give us an idea of the breadth of the role that you were performing, perhaps particularly in that first year and a half or so?
The role of the Government Chief Scientific Advisor is to provide science advice for policy rather than policy for science. So it's to try to ensure, and the job reports to the Cabinet Secretary and is accountable to the Prime Minister and Cabinet, that areas of policy consideration and thinking can be informed by science advice, whether short-term or long-term. That means areas like climate. We're a big focus of my attention. Areas like what the science system was in government and was it adequate to provide that right the way across every department, and areas like how the science base could be best harnessed to think about innovation and areas that might be relevant to the economy were the sorts of things that I was involved with. And indeed, even during COVID, those things continued. So I was the Chief Scientific Advisor for COP26 in Glasgow as well on behalf of the government at that stage. So there are many different areas that this role covers, and there's a separate Chief Scientific Advisor in each department as well.
Yeah, it's a very important fact for us to bear in mind, is it not, that although, of course, so much of your work during the pandemic was based on medical matters, which tallied with your own training, the role of Chief Scientific Advisor covers a far broader canvas. You've mentioned the environment. I think there's a reference in your statement, or possibly the notes, to matters to do with space exploration, dams overflowing, Novichok in Salisbury, a whole range of scientific matters in normal times.
Yes, and I would characterise that in three blocks. The science for everyday matters of policy in government, which covers everything, as you said, from things like space exploration to transport to other areas. There's a second block, which is in emergencies, and in my time there was an emergency obviously relating to Novichok in Amesbury and Salisbury. There was one relating to the potential collapse of the Toddbrook, the dam at Toddbrook Reservoir. And the third is science as it relates to economic matters as well.
Yeah. During that first period of a year or so before the pandemic, you were involved with, and I think commissioned, something called the Science Capability Review, and this is something you discuss in your witness statements. Can you give us a little detail of that exercise? And also, can you tell us whether there were any issues that emerged from that exercise that subsequently you felt were relevant to the way in which the pandemic was dealt with?
Yes, that was an exercise undertaken together with Jeremy Hayward, who was the then Cabinet Secretary, and the Treasury, to ask the question, was science capability adequate in the government for what I saw then as a central plank of what all modern governments need to know about? And the work, which was published in 2019, identified a number of areas. First, that the funding for science had decreased across many departments, and that left departments somewhat disabled in their ability to use science. Second, that the departments needed a chief scientific advisor who was more than a lone operator, that he or she needed a structure around them to be able to do it. And a series of observations about public sector research establishments and other parts of the government system. But perhaps the most sort of striking headline, in a way, was the realisation that the FAST stream, so the graduate intake programme for the civil service, where future permanent secretaries and leaders of the civil service come from, had an intake which comprised 10% of the intake comprised people with a STEM degree. So 90% was arts, humanities, social science degrees, and only 10% was a STEM degree, which struck me as being something that would destine the civil service to stay roughly in the same position as it has been for quite a long time.
Yeah, it was actually that last point that I wanted to pursue with you. It is a striking statistic. Perhaps it's obvious, but what was the effect of having only 10% of these leaders of the civil service with a STEM, with a science technology training?
Well, it means two things. It means that the routine consideration of science in policy formulation was not where it needed to be. Now, you can do some of that with the scientists trying to be round the table giving information. But the second is that it also meant that there isn't always a good receiving system for science, because a way of thinking, it's different from perhaps how others approach a problem. And that meant it wasn't always easy to get the right sort of pull for science across the civil service. And I'm really pleased to say, I should say, that as a result of that report, there's now a target to have 50% of the intake with a STEM degree, which I think is about right. It shouldn't be 90% the other way either.
Yes, do you know whether that target has been reached or how it's doing?
the target is set to be reached by 2024, and I'm going to look with interest from the sidelines to see whether it's achieved.
All right. Turning then to your role during the pandemic, Sir Patrick, at a very high level, those who have been following this inquiry, reading the document and so on, might think of your role as falling into three parts. First of all, your management role at Go Science, providing structure to those generating scientific advice, in particular, of course, chairing SAGE. Secondly, a role providing personal advice to the Prime Minister and other key decision makers. And thirdly, a presentational role, explaining scientific advice to the public, of course, in the press conferences that we're all familiar with. In broad terms, does that capture it, or are there other important aspects that you think we need to think about?
I think in terms of the work during the pandemic, those three categories are reasonable, although, of course, they're all quite broad.
Yeah. I mean, we won't be saying very much today about your role regarding vaccines, because, of course, that's going to be the subject of another module. But particularly given your background and your work with GlaxoSmithKline, you had a considerable role to play, did you not, in the development of the vaccine programme?
Well, I set up the Vaccines Task Force in order to get the appropriate skills and focus on what I saw as a major issue for the world, to get vaccines in time and of the right type, and to get them available, in this case, into the UK.
In terms of the second of those three limbs, the role providing personal advice, and as we will see, usually that was orally to the Prime Minister and his advisors. Initially, is this right, that was a function you performed at COBRA meetings. We've all seen the COBRA meetings that took place in the early stages of the pandemic. And latterly, it became something that you did at other committee meetings and also less formal occasions at Number 10.
Well, the personal advice element, of course, went to the Cabinet Secretary and others as well. It wasn't just to the Prime Minister. The COBRA system really was a place where the output from SAGE came into a ministerial forum and where other outputs would come as well. So that is the place where, certainly in other emergencies, I'd seen it work well, where different inputs, whether it's economic, whether it's science, whether it's something else, come together. Ministers make decisions, and there's an operational structure, which is the Civil Contingencies Secretariat, that would then make sure that the output of that was properly handled across Whitehall. So that had worked well in the previous emergencies I talked about, and that was the structure that was in place at the beginning of COVID.
Yes, and we will come back to explore in a bit more detail how well that worked and issues around the term of how your advice is to be docked and how that might be reflected in future occasions. But I wanted to, though, at this stage, just to clarify with you just how frequent those occasions were and how we should regard your role. The sense being this, that the inquiry has now heard from several witnesses who had as their full-time job advising the Prime Minister. They were with him all day, every day. They would spend, it seems, much of their days during this time talking to him about what steps should be taken, whether that's civil servants or his political advisors. How different was your role to that?
Oh, very different. I mean, it's not a role that lives in Cabinet Office or in Number 10. We came in the case of COBRA, to come in to give advice in the COBRA meeting. And then subsequently, as things ramped up and there were daily meetings in Number 10, I might be in there for 45 minutes in a meeting in the morning, and then perhaps not at all till the following day, or sometimes not every day. So this was an intermittent time to give science advice. I wasn't living and breathing the policy or operational aspects and didn't have a policy or operational role. That's for others who are embedded in that system to do. And I think it's also worth noting that prior to the emergency, I'd met the Prime Minister probably on a couple of occasions, and then met Mrs. May before that on 3 occasions. And I think I'm right in saying that my predecessor, Mark Allport, actually didn't have a meeting directly with Theresa May. So it wasn't as though the science advisors in and out of number 10 the whole time. That obviously came to be the case during COVID, but it was for specific purposes.
And we'll come to see that there certainly were times where you were meeting the Prime Minister on a daily basis.
Yes.
But not all day, and there would be some meetings that you attended and then you were asked to leave and other meetings would go on in your absence. Is that fair?
Yes.
You've mentioned already, but for completeness, although of course your work was so heavily focused on the pandemic during this time, were you in fact also required to perform some of those other duties we mentioned about matters completely unrelated to COVID?
Yes, there was a Chief Scientific Advisor network that continued, that obviously kept that going in departments. As I've said, I was asked to lead science for COP26, the climate conference in Glasgow, to make sure we had that side of things right. And there was work going on things like the integrated review, the position of the UK in the world, which had a big science theme in it as well. So work like that continued. And Go Science continued to produce other reports, but was, of course, the absolutely major focus was at all times on the pandemic, and that took precedence over everything else.
Yes. Could I ask you to look at paragraph 13 of your witness statement on page 9, please? And picking it up about half the way down, you say it was by chance that as Chief Scientific Advisor you had a background in medicine and pharmacology. You say that, as we've already noted, the person filling that role could come from any scientific discipline and is expected to cover all scientific areas. And you say it would be wrong to expect, and this perhaps follows from what you've said, that any future scientific advisor would have specialist knowledge on medical or epidemiological matters. First of all, given your no doubt fortuitous experience in medicine and pharmacological matters, did you, on reflection, do you think that you played a greater role in responding to this pandemic than perhaps you might have done if your speciality had been different?
I think the role of the GCSA would still be to chair SAGE, and during a health emergency that's done together with the Chief Medical Officer. I think that would have continued. I think inevitably there were some aspects of what I did when I was called in because of my particular knowledge, particularly as you've mentioned around vaccines, where I had a role which I don't think in any way would be something that the GCSA would normally necessarily do. And I think definitely, I had more knowledge of some of the areas that were being discussed than a GCSA would have in day-to-day SAGE activities for this particular emergency.
And looking forward, Sir Patrick, given, first of all, the profound effect that the pandemic had on this country, and also, as you've said, not the likelihood, but the certainty that there will be another pandemic in due course, do you think it's right that the Chief Scientific Advisor should continue to be selected as someone who may or may not have a medical background, or do you think that, in fact, the person fulfilling that function ought to have some relevant expertise that would be useful when the next pandemic arrives?
I don't think the GCSA role is set up primarily for pandemic preparedness. It's set up to provide science advice across government. The great crisis that all governments face for the next many decades is the climate challenge, and so it would be equally well argued that you could have somebody who has that expertise. So I think the GCSA should be appointed on their scientific knowledge and breadth and their ability to work across areas, and there should be no expectation that a GCSA is necessarily expert in this area.
Thank you. Just finally on this sort of introductory section, we haven't mentioned so far Professor Whitty. And if one thinks back to those three limbs of your function during that time, it's right, isn't it, that to a greater or lesser extent, you performed those functions jointly with him?
Yes, I mean, there is a difference in that the Chief Medical Officer role is clearly solely focused on matters of health and particularly has a remit for public health and is embedded in the Department of Health and Social Care. So it's a departmental role, very senior role, a rather older role actually than the GCSA role in terms of the government, and that has an overall accountability for that. And of course, to some extent, is closer to policy questions as well as the medical advice that's given.
Well, this is a theme I wanted to explore briefly. And if we can look at paragraph 98, please, on page 34. Again, picking it up about half the way down. You refer there to the DHSE as being the lead government department for pandemic planning and operations. You say it would be inappropriate for you to become involved in operational delivery plans. And then you make the point that the CMO and one of his deputies were infectious diseases experts, epidemiologists, and you then refer to Professor Horby, who was chair of NERVTAG and so on. But more generally then, were there particular areas where Professor Whitty took the lead, as it were, between the two of you in responding to the pandemic?
Well, can I first make the point that operational delivery is absolutely outside the scope of the GCSA role. It's a science advice role. It's not a policy or operational role. The CMO and many of the other experts from DHSC, of course, took the lead in things in the department and were very much in the driving seat in the initial phase in January when this was a departmentally led response. And at all times, the CMO, of course, would take the lead on clinical matters and matters relating to medicine, NHS, and other things which were outside my remit, and is deeply expert in this. I mean, this was his expertise in academia and clinically.
When you say this, you mean?
Pandemics and epidemiology and the spread of infections. That is his background.
Yes. Well, let's turn then, if we may, to that early period.
And by the way, he's very good.
He's very good. Well, if he's watching, I'm sure he's grateful for that. January to March 2020, Sir Patrick. I'd like to start, if I may, by looking at an email that Professor Woolhouse sent, and which the inquiry has seen before. He didn't send it to you. He sent it to two people that you knew, Jeremy Farrar and Neil Ferguson. And if we can look, please. Yes. So this is we see that an email sent on Saturday, January the 25th. He sends Jeremy and Neil, as he calls them, this email. We'll come to see, and I imagine you've looked at this already, that part of their response, I think it was Neil Ferguson's response, is to say that he had been having a similar conversation with you. So that's why I ask you about this, even though you weren't, in fact, the recipient of the email. And we see, do we not, Professor Woolhouse sketching out, on the basis of some fairly broad brush analysis and some basic figures, his understanding of the coming pandemic. He refers in the second paragraph to two key numbers reported in the WHO statement, the R number of 2, the case fatality rate of 4%. He talks about making a reasonable guess at the generation time. And then he says, and we can see that in the paragraph 2 below, he talks about this being a rough calculation that his undergraduate class could work out with a pocket calculator, a ballpark estimate of half the people in the UK getting this infection over a year or so, a doubling of the gross mortality rate, and, as he puts it, a completely overwhelmed health system. And then, 2 paragraphs down, having asked the question, what's the right response, he adds, his words, that's not a worst case, that's based on the central estimates published by the World Health Organization. So we asked him about this, not a scenario, but, if you like, a prediction. And then if we look back one page, please, we can see, yes, at the very bottom of the page, we can see that Neil Ferguson responded by saying, fully agree. Jeremy and I were saying the same to Patrick Vallance and Chris Whitty last night. Do you remember that particular conversation or conversations with Jeremy Farrar and Neil Ferguson about that time dealing with this sort of analysis?
I don't remember a specific conversation, but I had many conversations with both of them and others around that time. And it was very clear from the numbers that we'd already looked at in the first SAGE meeting we'd called, that this had the potential to be really quite devastating. And the numbers of potential deaths and infections was extremely high. So I don't think there's anything in here that's terribly surprising. And it was indeed the case that we knew that if this got to the UK, if this spread around the world, that this would have a large effect.
I don't want to split hairs, Professor, but you've used the word potential there. The point that Professor Woolhouse makes in his email is that it's not a scenario, it's not a worst case, it's something that, again, I don't want to get into technical terms, but he seems to be trying to convey the impression that it's more likely than just something which is a scenario or something which might happen. I mean, is that sense something that you shared at the time or not?
Well, I don't think at that stage this had escaped China in a sort of uncontrolled way. So the first question was, would it fully escape China in an uncontrolled way? The second thing is that we didn't really know on the overall transmissibility as to whether this would be contained in the way that SARS and MERS had been contained at that stage. And so I don't think it was inevitable at that moment that this would spread. And you can see lots of opinions being expressed quite forcibly by people around then as to whether it would or wouldn't reach right the way across the world. And WHO, I think at this stage, hadn't declared it as a public health emergency of international concern. It certainly hadn't declared it a pandemic. So I think if it escaped and if it continued to behave with the numbers he said, then yes, that's true. But we didn't know that at that stage. And I think you can see actually by people's behaviours and even senior scientists' behaviours over the next few weeks that not everyone was behaving as though this was going to happen necessarily.
Do you think they should have been?
Well, I think it's very difficult to know whether this was going to be contained in China and elsewhere. And had it been, then it could have been shut down. And it wasn't. And it became spread much more easily than I think anyone had anticipated, much more easily than SARS and MERS, which were containable. And that's what was not known at the time.
Right. Let me move on. I want to ask you some questions about this whole question of NHS capacity. As we know, and the inquiry has heard detailed evidence, the strategy which was adopted over this time has the mitigation strategy, as it's been described: contain, delay, mitigate. And within that context, if we can look, please, at paragraph 204 of your statement, page 65, I think it is. Yes. So, picking it up at the bottom, you describe, and again, the inquiry has heard plenty of evidence about the policy to flatten the curve, which is shown in that graph that we can see further up the page. You say you understood this to be a continuation of the existing policy goal once containment was not possible. And if we can go over the page, please. You say the graph shouldn't give rise to a false sense of precision. And then this: no minister defined a cut-off point for the number of infections or deaths other than by reference to avoiding the NHS being overwhelmed. And 2 points to pick up on that. Firstly, an issue you raise at various points in your different statements is that there was, I think generally throughout the pandemic, and certainly in this early stage, a lack of clear understanding on the part of the scientists of what the government policy was. And to put it another way, the scientists lacked a baseline against which they could do their modelling and provide advice. Is that fair? Is that something that you raise and which applies at this time?
I think, in a sense, there were three broad possibilities. One, that the disease could be contained and eliminated. The second, that the disease would run wild and not be controlled at all, and people would make no effort to do anything. And the third was to try and control it in some way to minimise the impact. And we didn't know at that stage whether it was fully containable or not. But once it breaks out, and by the way, the breakout of containment domestically is dependent upon the infrastructure you have, so the test, trace, isolate infrastructure. But once it breaks out, then my understanding from the beginning was the government did not want to do anything other than it didn't want to let it run riot. It didn't think it could get to zero COVID, and therefore it was to control it and suppress the numbers in reference to the NHS being overwhelmed. That was the closest we got to sort of understanding the aims, coupled with, as you'll see later, a desire from the government not to impose overburdensome restrictions on liberty.
Yes. So my question is, on that first point, and maybe this wasn't a moment where you might have wished for greater understanding of policy, but might you have wished for more detail from the government about precisely what they were prepared to accept or not accept in terms of mortality, or was it enough simply to be told, we just don't want the NHS to be overwhelmed?
Well, I think it would have been helpful to have that, but I also think, and I think I say this in my witness statement, we asked it several times to try and define a number, and nobody would give that number. I do think that's a very difficult question to answer. So mathematically, it's rather helpful to have it. It's actually a difficult question to answer. But at the what we had at this stage was NHS not being overrun.
Yeah. And so moving from there, given that that was what you were being told, do you think that enough was done during February to understand what that meant and what an NHS overwhelm would look like, what the numbers involved were?
I think the numbers, well, there was a lot done in terms of what needed to be, what the options were to reduce the spread. So quite early in February, work started on non-pharmaceutical interventions. Neil Ferguson in particular drew up a lot of modelling around that, what the different options were, and came up with a figure that others endorsed as well of needing to get a 75% reduction in contacts in order to try and really suppress this to the right level. So there was a lot of work done on the modelling. There was a lot of work done exposing those options into COBRA, including with the behavioural science input on that. And there was a discussion, which I think Boris Johnson puts in his statement, which he had with the CMO at the end of February on lockdown options and what the implications of those would be. So I think there was a lot of evidence that there were things that needed to happen in order to achieve this aim of suppressing the curve. I'm not convinced that there was a very effective operational response to that.
A lot of work you described on understanding the growth rate of the pandemic and different MPIs that might be used to suppress it. My question is, running alongside that, if the policy direction was, yes, you must suppress it, but the target is to keep it below the NHS, was there enough work going on in parallel to understand what that cap actually meant?
Thank you. Sorry, I didn't answer that part. We had great difficulty, I mean, when I say we, the modellers, had great difficulty in getting clarity on the NHS numbers. What we did know was that the NHS runs at pretty much 100% capacity, which is quite unlike most other countries. So we knew that the NHS capacity was likely to be very full anyway, and trying to get precise numbers on ICU beds and occupancy of other types of high dependency beds was pretty difficult during February, and I think it culminated in a meeting which I think I asked to be set up at the first day of March with the NHS modellers to try and see if we can resolve this logjam. Why was it so difficult to get the numbers?
Let's just look, if we can, at an email exchange you had with Ben Warner. So this is 195863, please.
Mr. O'Connor, you're coming back to what Sir Patrick meant by the operational response being not very effective?
Yes, I will, I think. This is an email exchange, Sir Patrick, late in February, the 27th of February, so a month or thereabouts after the email we saw with Professor Woolhouse, and well into the time, judging by your statement, that it was understood that NHS overwhelm was the policy aim, what you were supposed to be avoiding. And Ben Warner says to you, he's a little concerned the NHS didn't seem to know what they needed for their models, didn't seem to have started modelling, and then your response, you've been pushing them on this for the last 10 days or so. You think they've now grasped it as a meeting planned for Monday. They haven't defined their input variables well enough. Taking a step to one side, Sir Patrick, you've already mentioned issues such as NHS capacity. Was it really a complicated modelling exercise that was needed, or was there simply a sort of basic mathematical exercise of how many beds have they got, at what point on our understanding of the pandemic will they be overwhelmed? Is it that complicated?
Well, in one sense, no, it's not that complicated. And in exercise Nimbus, which I think took place in the middle of February, the question of NHS capacity inevitably being overrun was discussed, and Simon Stevens, I think, has referred to that. So it was very clear that the projections, the worst case scenario, would overrun the NHS. That was clear and discussed all the way through February. What is being asked for here is the point that the modellers needed better information to try and understand when that was going to occur and what the warning signs were. Because at all times during February, from a scientific point of view, and this goes right back to a comment that Sir Chris made in February, we wanted to try and understand the mechanisms to get R below 1, to make the pandemic shrink. The question then was, when do you trigger that, and how deeply do you trigger it in terms of the number of things you need to have? That's what we were trying to understand, and the modellers needed the precise details to be able to understand what that looked like. So this was not an academic exercise. It was important for them to understand, and we thought it should be relatively straightforward to get these numbers. It turned out, like a lot of data flow early in the pandemic, it wasn't easy to get these numbers.
When we look at, I think you said there was a meeting in early March, and when we look at some of the data that was provided, the modelling from the NHS, if we can look at 146571, please. This is the 9th of March, and if we could just zoom in on those bottom two graphs, please. The essence of it seems to be that there's a peak, this is the unmitigated peak, and that what someone has simply done is drawn a line relating to total NHS beds on the left and critical care surge beds on the right, and said, well, there you go, that's the point of overwhelm. And if, just for completeness, perhaps we better look at the next page, please. A different graph there, that's the mitigated peak. The same lines are drawn. It doesn't look, at first blush, as though that is an exercise that really needed to take weeks and weeks and weeks, and we don't know what the variables are, we don't know what the inputs are. It looks like someone has just said, well, this is how many beds we've got, we'll draw that line on the graph.
Well, that's fine for this, and that was not what the modellers were asking for. But this is absolutely understood, and it was understood in Nimbus in mid-February, that in a big peak, the NHS would become overwhelmed. What it doesn't tell you is at what stage you think you need to act in order to do something. That's what the modellers were trying to understand and why they needed more precision. But I mean, on a basic level, anyone could see that if you had a huge wave of infections, it would cause this problem.
The reason I'm asking, Sir Patrick, is that, as we know, and we'll come to this, when the weekend of the 14th, 15th of March came around, one of the reasons why it was felt necessary to take sort of dramatic steps or change direction, depending on which way you look at it, was a new understanding that the NHS was going to be overwhelmed. And I suppose my question is was that part of the analysis something that could have been understood earlier if only more urgent steps had been taken in February to do this sort of analysis?
Oh, I don't think there's any doubt if you look at the CRIPS in February that people understood the NHS could be overwhelmed. So I don't think that's a new understanding. I think the new understanding on the weekend of the 14th and 15th of March was that we were much further ahead in the pandemic than we realised. And the numbers that came in that week showed that there were many more cases, it was far more widespread, and was accelerating faster than anyone had expected. That's what triggered an urgent recognition that this was an imminent problem of the NHS collapsing, not something that was weeks away with the possibility of introducing measures at a more leisurely rate. So that weekend was an intense acceleration and indeed intensification of the measures that were required to stop this.
Let me turn then and ask you some questions about that weekend. And by way of introduction, it's well understood that different people who were there seem to understand the events in perhaps a slightly different way. Some people regard it as being a time when measures were fast-forwarded or accelerated. Other people regard it as a change of direction. But certainly, I think, do you agree, it was, on any view, a time when decisions were either made or started to be made that a suppression policy, a policy of trying to keep the pandemic, the R number below 1, needed to be introduced, whereas previously that point hadn't been reached. Is that fair?
Well, the plan right from early February was to keep R below 1 to stop it growing, but this was a recognition that this had to be really implemented very, very hard at that weekend in order to achieve that. So all of the measures needed to be put in place.
Is that right, that the plan from the very start had been to stop the pandemic growing? We looked at those charts and we see a curve. I mean, flattening the curve is not the same as suppressing the virus, is it?
I think ultimately it is a question of how far you want to suppress it. So you could suppress down to 0, which was never the aim. You could suppress a little bit, but you couldn't do that if that was going to overwhelm the NHS. And so the question was how far you needed to suppress it and at what stage you needed to do that. And I do think the focus on trying to get that timing exactly right was incorrect. It was an error to think that you could be that precise. That's a really important lesson that came out of this. I'm afraid you need to go early.
Yes. Well, we'll come to that idea of yours, which you repeat in your witness statement. I want to ask you about a passage from Ben Warner's witness statement, please. So if we can look at paragraph 303, yes, we have it there on page 78. It's the final sentence. No, sorry, the final two sentences. He says, changing from a mitigation strategy to suppression midway would have been the worst of all worlds. And then this, from early 2020, we should have developed alternative plans, for example, lockdowns, after seeing the actions in China, or at least after northern Italy. So his reflection, and it's one which is shared by some others in number 10 who we've heard from, is that the events of that weekend, in hindsight, suggest that they had previously been on the wrong plan, and that they should have been thinking about a different plan, a suppression plan, earlier. Is that your view? Do you think that is a valid criticism of the science or not?
I'm not sure that he's criticising the science, actually. I think he's talking about the operational plan to deliver. So that the notion that you had to intervene, and there are multiple emails and charts and things that were presented at COBRA meetings as well, talking about the combination of NPIs that would be required to reduce the spread and to get R below 1. The question was when and how much to do it. And this unfortunately wasn't mirrored by an operational readiness. So the bit that I think is missing is whether the operational development of plans to do that at short notice were as advanced as they should have been, and they weren't.
Are you there talking about things like test and trace?
Well, test and trace for sure. We had an isolate. We had an inadequate scale of facility to do that through Public Health England, but also the plans for introducing the NPIs. Right. I think, given that they're described quite early on, there should have been an operational plan to have those ready to pull the trigger on as soon as they were needed. And what we see is it takes quite a long time to get those actually working and to get the process in place to do that. I think that is a sort of learnable lesson that you should start earlier. And I think I take the comment Andrew Parker, the previous head of MI5, has said very clearly that he heard the warnings that we were giving in early February and took actions in that organisation to do things. I'm not sure that that urgency of action was as consistent and as reliable as it should have been across Whitehall at that time.
You've focused your remarks very helpfully, very clearly on the operational, if you like, the implementation aspect of this. It may be that Mr. Warner was also directing at least some criticism towards SAGE and saying that SAGE should have thought more about lockdowns and more severe, more stringent MPIs earlier. As you say, it's ambiguous, but is that a fair criticism to make?
Well, I think if you look at it, we thought a lot about MPIs. There's lots of work on NPIs, lots of work on the notion that you had to have lots of NPIs, you had to use them together probably, that this was going to be behaviourally difficult. There was links to the behavioural science group to look at that. All of that was done through February. Where we were wrong, and I think it's very clear, is our belief that we understood when to do that. It wasn't that we hadn't said do it and that this is going to be needed. It was that we thought we could understand when to do it. The data that came in during the week leading up to the 14th and 15th showed clearly that we were much further ahead. It was much more likely to be needed urgently than anyone had realised. That's a data problem, but it was also, I think, a scientific problem in that you can't manage this with the precision that you think you can, and you therefore have to take different actions.
I'm going to come back to the decisions taken over that weekend briefly in a moment, but I'd like to take a step to one side before I do that and ask you some questions about your relationship with Professor Whitty at this time and the extent to which your views differed. And if we can look, please, at 214802. This is an extract from Jeremy Farrar's memoir, one of those memoirs from scientists that you referred to, Sir Patrick, giving us an insight into events. Sir Jeremy, of course, was a member of SAGE during this time, was he not?
Yes, he was.
And he describes, we see the second paragraph there, a friction, as he describes it, between waiting and wading in. He says it led to a palpable tension between Patrick and Chris in the early weeks of 2020, particularly given the apparent absence of political leadership in that period. And he refers to the fact that Boris Johnson didn't attend the first COPA meetings, as we have seen. So it's what he describes as a palpable tension between waiting and wading in. And there are some references, Sir Patrick, in your notes, which would seem to support that suggestion. And if we can look, please, at 273901, this is the schedule. And I just want to show you a few references, Sir Patrick. In January, perhaps we ought to say that you weren't, in fact, writing these notes contemporaneously for the first 3 months or so of the pandemic, where you wrote a sort of catch-up section in March or thereabouts, looking back to the early months. But relating to January 2020, you said Chris thought would be contained. PM said his guts tell him it will be fine. But then Chris Whitty at the end, more cautious than me. If we can go to page 3, please. The last sentence or so, Chris Whitty worried about pulling the trigger too soon, cause harm, introduce some stuff on behavioural fatigue if you started too early. And then on page 582 of the schedule, there is an entry that you made much later on, but reflecting on the early events. So we're now in February 21, but Sir Chris talking afterwards about the inquiry, was lockdown too late in March? Could we have known? And then this, he was a delayer, of course. So help us, Sir Patrick, was there this tension or friction between the two of you about how quickly to proceed with NPIs in that first period?
Well, I think Chris Whitty is a public health specialist, and he was rightly, in my opinion, concerned about the adverse effects of the NPIs. He was concerned that there would be more than just the issue of the direct cause of death from the virus, that there would be indirect causes of death due to effects on the NHS, that there would be indirect harms due to people isolating, mental health, loneliness, issues of health that come from that procedure, and that there would be indirect long-term consequences due to the economic impacts creating poverty, which is a major driver of health. So he was definitely of the view that the treatment and the result of that treatment needed to be considered together, and that pulling the trigger to do things too early could lead to adverse consequences. And that, I think, is a totally appropriate worry from the Chief Medical Officer and a legitimate public health concern throughout. And I didn't have exactly the same worry. I was more on the side of we need to move on this. But I think that's partly why the two of us found it useful to work together. I mean, he would bring in views that were broad public health views looking at the consequences of interventions as well as the direct consequences of the virus. And I think sometimes I would want to push and he might not, and sometimes he was right, and sometimes I think we should have gone earlier. This was an occasion when I think it's clear that we should have gone earlier.
Let me go back then, with that in mind, to those meetings over that weekend of the 14th and 15th. We've gone to them in some detail with other witnesses, and I'm not going to go through them in detail with you. But in summary, what was it that you were arguing for during the course of those meetings, and what was your understanding of what was decided?
We got information on the 13th of March, which unambiguously showed that the pandemic was far more widespread and far bigger and moving faster than we had anticipated. And that came from a number of sources, including surveillance systems that we'd set up to look at people who had pneumonia, hospital-based surveillance, and some work coming in from the initial sporadic surveillance systems and NHS numbers. That was unambiguous and extremely worrying. Over that weekend, it became very clear that much more stringent measures would be needed to control this, and they needed to be introduced quickly. I made my views known about that was the view of the SAGE committee and the modellers, and it was my view that we were in a position now where we had to move quickly. That decision, I believe, was understood. On the Sunday of that weekend, I was unambiguous in the meeting that much more stringent measures would be needed now. I think that's recorded in Imran Shafi's notebooks. And the following day, when the Prime Minister announced that there would be voluntary measures to keep people from making contacts, I also suggested on that day that London was so far ahead that it would be necessary to possibly lock down London. So those were my views over that weekend. I think, frankly, on that weekend, an in principle decision was taken that lockdown would be required. It then took several more days to work that into a full mandatory process. But whether it is mandatory or voluntary is a political issue, not a scientific one.
We know, and we've heard from others, that the term lockdown may not have been one that was in play then, but you have said that your view, in essence, was that that was what you were campaigning for at the weekend, and there was at least an understanding that that was where things were headed as early as that.
Well, I wasn't campaigning. I was trying to point out what the evidence was and how I interpreted it and what SAGE thought. And Neil Ferguson's work and others' work during February had shown that in order to really get this down to the levels that would need to be reduced by, you needed to reduce contacts by 75%. That is a huge reduction, requires all sorts of interventions. I'm not even sure we ever really achieved much more than 75% at the peak of the interventions. And that's what I was arguing for on that weekend, that if we wanted to now stop this from becoming devastating, we needed that degree of reduction of contacts.
Now, there are various references in the documents, in your witness statement, to the reaction of some of those who were at those meetings to what you were saying. You refer in places to people being incandescent, and you also refer to yourself having been reprimanded for advancing those views. Who was it that reprimanded you?
Well, I got a message back that Chris Wormold, the Permanent Secretary at DHSC, was incandescent with rage, as was the Cabinet Secretary, about the fact I'd said this during the meeting on the Sunday. I subsequently spoke to Chris Wormold and asked him why he thought that was something to be incandescent about, and he said it was the manner of raising it in the meeting rather than the substance that he was concerned about, and that I'd sort of thrown it into a ministerial meeting, whereas it should have gone through more due process. But I stand by the fact I think it was the right thing to say at the time.
That was the reprimand as well, then, was it, for the manner in which you raised it?
Yes, I was told that I hadn't done things the right way and it was inappropriate for me to have raised that. And I subsequently, on the Monday, when I suggested that London was so far advanced, and it's worth remembering actually that in terms of timing of this, London was quite a long way ahead of other parts of the country. So although we had seeded the infection right the way across the country, other bits, you could argue, went into NPIs really quite early. Certainly earlier than other countries when you look at where it was. London, though, looked like it needed more. And I made that point in that meeting. It was discussed. There was a very clear rejection of that proposal. And certainly, I don't think the Chancellor looked terribly pleased at that moment.
Why not?
Well, quite rightly, he's concerned about the economy. And London was very much the engine of the economy. And that was a massive, massive decision to take.
Well, we may come back to that, but just last question on the reprimand. There is one of the documents amongst the disclosure which suggests that Sir Chris Whitty was one of those who reprimanded you on this occasion.
No, Chris was the messenger.
Right.
He did not reprimand me.
He didn't have skin in the game.
No.
I want to move on, and the last set of questions on this particular issue is about the timing of the lockdown. You, as I understand it in your statement, say that you think this first lockdown was imposed a week too late. And I think you're referring there to the delay, as you would put it, from that weekend when the discussions we've just been covering were had, and the mandatory lockdown which was introduced a week later. And the word you use is implementation, so a delay in implementing the decision. First of all, is that a fair summary of your witness statement?
Yes, I think that's probably the earliest at which that decision could have been made, maybe a few days earlier if we'd got the information. I remember at the time Neil Ferguson wrote that we were taking actions earlier than other European countries relative to where we were in the pandemic. But I think that weekend was, in principle, a decision that all of these measures would be needed. And I think it would have been sensible to have got on and done those as quickly as possible. But, I'm not an expert in how you implement these things, how you operationalise them, what the legal requirements are, and there were some very significant legal requirements around that, and that took another week or 10 days for that to be in place.
So those are the operational implementation type matters, which in fact we touched on when we were discussing Mr. Warner's evidence. But what I want to press you on then is the period before that, bearing in mind what was understood about NHS overwhelm, bearing in mind the modelling and so on, do you think that that set of decisions, that understanding that was reached on that weekend, could or should have been reached earlier?
Well, I've just said I think it could have been a few days earlier. I think it's difficult to know if you look at the numbers of cases and the numbers of people who, even by then, were beginning to show how serious this disease could be. The measures themselves are not neutral, they're harmful. And so the question is around timing. It's around when you're prepared to take an intervention, accepting that you're about to cause definite harm, because we knew the interventions would cause harm. We didn't know exactly how many of them would be needed to stop the spread of the disease. I think it's difficult, and I think other witnesses have said this, I think it's difficult to conceive that that would have been much before that weekend. I mean, maybe a few days, but we would have required very different systems. And it's worth actually doing the thought experiment to move to September, when we did know what the consequences of this virus was. We did know that the measures to restrict contacts worked, and we did know that you had to move early. And the number of infections and deaths at every stage for subsequent decisions were orders of magnitude, in some cases, higher than at that period in March. So I think, in retrospect, the March decision was earlier than some of the later decisions, even with the knowledge that came with that. So I think it's difficult to conceive that decision would have been made much before that weekend, as I say, possibly a few days.
We certainly will be coming on to talk about later in the year and September and the second lockdown and so on. But before we leave this, the premise of my question so far has been that there was going to be a lockdown in March or thereabouts. It's just a question of when it happened and could it have been imposed earlier. Adopting the same hindsight approach, do you think that in fact that first lockdown might have been avoided altogether had things been done differently?
I think that if we'd had a scaled test, trace and isolate system in place, you stand a better chance of keeping this under control. I think that in that situation, even a short type of lockdown, without defining exactly what's in that, but MPIs to try and reduce it, could have brought things down and then kept it under control with test and trace. But the reality was we didn't have tests at scale, we didn't have a test and trace and isolate system at scale, and we were unable, or PHE and the organisation seemed unable to be able to operate that, and that would have required a lot more planning over previous years than had occurred. Even with that, because we got seeded so widely across the UK, not from China, not from the countries where people thought this would come from, but from Europe, with huge importations, and we can see this in the genomics.
This is half term?
This is half term. And we had a huge influx from Spain, France and Italy over that half term and beyond, which meant that we probably had lost control. And test, trace and isolate only works at low levels of prevalence and a high level of capacity in the system. So, sorry, that's a long answer, but I think with everything that we had in place or didn't have in place at the time, I'm afraid that the sort of ultimate option of trying to lock things down probably was the only route open at that time.
Yes. Thank you very much. Sir Patrick, Melody, is that convenient?
Yes, just before we break, Sir Patrick, as you know, we take breaks for everyone just to take the opportunity to take a breather. When you had this so-called reprimand, you said it was the Permanent Secretary of the DHSC, Christopher Wormald, and the Cabinet Secretary. Were they really more concerned about the process aspect of what you were saying than the substance, which was basically the dam has burst?
That's what they said to me after. When I spoke to Chris Wormald about it and said, I hear you're very cross with me for what I said, his response was, there are ways of doing this that we need to do to make sure it's structured and ordered and it goes with a proper process rather than the fact that I'd said it as statement. And we agreed to differ a bit on that. But
I won't ask you for your reaction to that. Very well. A 15-minute break.
All right.
Mr. O'Connor.
Sir Patrick, I want to move on and ask you some rather more general questions about different aspects of the pandemic and the response to it. And first, I'd like to ask you about the words "following the science," the mantra. We'll see that other people's words, not mine, that we heard so much of, at least in the early stages of the pandemic. And I'd like to ask you to look at a section of the expert report that the inquiry received from Alex Thomas, or latterly at any rate, from the Institute for Government, and paragraph 120 of that, please, on page 35. And it's, as I say, paragraph 120 where we see his views on this issue. He says there was a blurring of policy decisions and expert advice, with ministers' mantra that they were, quotes, following the science, very damaging. The repeated assertion undermined the importance of ministerial judgment and the accountability of ministers for decisions. It made it harder for experts to set out their view, and the science implied that there was one single view, which was rarely the case. From the start, ministers and other government communicators should have been talking about being informed by, not led by, science. This is an issue that you touch on in your witness statement, but you don't perhaps go into it in slight as much detail as there. Do you agree with these sentiments?
I do, and I didn't when it first happened. In other words, when it was first said we're following the science, my reaction was good, they're listening to us, because that's not always the case in government for the reasons I've laid out. But I think that the way in which this was both heard and possibly meant in terms of slavishly following the science, obeying it at all times, is completely wrong. I mean, you can't, and I can also totally agree, there is no such thing as the science. I mean, science, by its definition, is a moving body of knowledge that tries to overturn things by testing the whole time.
So you say that when it was first used, you weren't opposed to it. Was it then something about the number of times, the repetition of it, or perhaps the circumstances in which it was used? I mean, at what point did it become a negative thing for you?
Well, pretty quickly. I mean, initially I thought, good, they're listening to us and they want to hear the science. That is the right thing for them to do. But I think it became taken, both interpreted, I think, widely in the press and, again, possibly inside government as well, as a sort of direct following the science, a slavish following of it, which I agree, these are difficult ministerial decisions. They are precisely what needs to be taken by ministers to integrate the different forms of evidence and make those almost impossible judgment calls, which the science can't make and shouldn't make.
Did you speak to Boris Johnson or others asking them not to use that phrase?
I can't remember whether we did. They knew that this was damaging at one point, and I think they did. It did sort of get softened to we're being informed by, and I think the Prime Minister at the time actually says that at some point, that we're being informed by the science quite early on in March or April, I can't remember when.
In her witness statement, Helen McNamara made the observation in this context that you would never hear a politician saying that he or she was following the economics and drawing that distinction. Do you think that one of the reasons why this phrase may have been used was because the politicians didn't feel comfortable about their understanding of the science, and so, if you like, they said they were following the scientific advice in a way that, as Ms. McNamara said, they would never say they were following economic advice?
I think that is true. There's a great variability and largely an uncertainty and unfamiliarity with science in government. And my experience is that many people who haven't had a scientific training also view science as giving immutable facts. You know, they remember at school they were taught a lot of facts about science. The truth is that science is a process. It's a way of testing what you currently know, experimentally or observationally, overturning hypotheses, advancing and trying to increase your knowledge base. And it's a description of what you currently have, which can easily be overturned by new evidence. And I think that's not widely understood. I mean, understood may be the wrong word, but it's not intuitive to many people. And therefore, I think there was a bit of dependency that this was a scientific problem and people would listen slavishly to this and wanted to sort of slightly hide behind this at times.
Just going down the page, let's look at paragraph 122, please. A related but slightly separate point that Mr. Thomas makes. He said that SAGE ended up filling a gap in government strategy and decision-making, which meant that government decisions were held off until the scientific advice was overwhelming, rather than using scientific inputs alongside other analysis to take decisions at the most appropriate time. Again, sentiments that you endorse?
I agree that we ended up filling gaps, and there are several examples where we did step into places that we thought just needed some attention, and we tried to provide that. And there are several examples in my statement. I also think it's true that other inputs weren't as visible and weren't as obvious, and so there wasn't that overt ability to trade off between them. And I think I made this point about the economic analysis. I mean, it wasn't obvious where that was coming from, and it wasn't visible, and that led people to assume, therefore, the science was the decision-making force. So I think I don't think I disagree with anything that's written in this statement.
Yes. Well, and the point about economic input is one that we will certainly come to in due course. I'd like to move to a related subject, which is about the ability or the ease with which government ministers, civil servants, decision makers understood the advice that you were providing them with. We've already touched on the point about the proportion of fast stream applicants with STEM degrees, and of course this question of non-science graduates struggling to understand scientific matters is a very old one. In your witness statement, perhaps we can go to page 207 of your witness statement, paragraph 642. You describe, if you like, your general experience of providing science advice to decision makers. And picking it up about 4 or 5 lines down, you say, I'm not in doubt that the CMO, that's of course Professor Whitty, and you gave advice from SAGE repeatedly, and that it, together with the uncertainties, was usually understood by decision makers. However, it was often necessary to explain scientific concepts on many occasions. You say it's entirely appropriate for decision makers to challenge advice and so on. Then in the next paragraph you say you were asked a number of questions about whether the science advice that you provided to the Prime Minister and core decision makers was understood. You make the point that others will be better placed to answer that question, and of course we can ask the Prime Minister and others. But you say again that you took care to explain these concepts in a way that was comprehensible, which was appropriate, And a couple of sentences on, some points had to be explained repeatedly, and some areas proved more difficult to get across than others. And just flicking onto the next page, you make the point that some concepts were particularly challenging, for example, absolute and relative risks in relation to comorbidities. I just want to take you, Sir Patrick, to a few entries in your notes which touch on this subject and try and get a feel for whether that is a general position and whether those reflections apply particularly to the Prime Minister, or whether, in fact, the position was more marked with him. So can we go, please, in the schedule, first of all, to page 42. So this is an entry on the 4th of May, and by this stage you are making the notes daily, is that right?
Yes.
You say, late afternoon meeting with the PM on schools. My God, this is complicated. Models will not provide the answer. PM is clearly bamboozled. Page 53, please. PM asking whether we've overdone it on the lethality of this disease. He swings between optimism and pessimism, and then this. PM still confused on different types of test. He holds it in his head for a session, and then it goes. Page 93, please. Watching PM get his head round stats is awful. He finds relative and absolute risk almost impossible to understand. Page 124. PM struggled with whole concept of doubling times, just couldn't get it. And then just two more, please. Page 167. This is from later in the year, September. Claire Gardner going through the PM talked PM through the graphs. It's difficult. He asked questions like, which line is the dark red one? Is he colourblind? Then, so you think positivity has gone up overnight? Oh, and oh God, bloody hell. But it's all the same stuff he was shown 6 hours ago. And then finally, 389. This is now going forward to 2021. PM dashboard. Is that a reference to a meeting, dashboard meeting?
Yes.
Taken through the graphs, real struggle to get him to understand them. So the question then, Sir Patrick, is those paragraphs of your statement that we looked at. Yes, you talk about sometimes needing to repeat things and needing to explain things in detail. Help us and tell us if this is an example of passages that you no longer want to support. But the message that we get from these repeated entries appears to describe something, at least as far as the Prime Minister is concerned, more serious, a repeated failure to understand graphs, scientific concepts and so on, forgetting things that had been explained to him only a few hours earlier repeatedly. Was there a more serious problem with him than that which you describe in the witness statement?
Well, I think I'm right in saying that the Prime Minister at the time gave up science when he was 15. And I think he'd be the first to admit it wasn't his forte, and that he did struggle with some of the concepts, and we did need to repeat them often. I would also say that a meeting that sticks in my mind was with fellow science advisors from across Europe, when one of them, and I won't say which country, declared that the leader of that country had enormous problems with exponential curves, and the entire phone call burst into laughter because it was true in every country. So I do not think that there was necessarily a unique inability to grasp some of these concepts with the Prime Minister at the time, but it was hard work sometimes to try and make sure that he had understood what a particular graph or piece of data was saying. And I'd learned from a number of meetings, including around climate, where there were certain things that would catch his eye and would work for him, and other things that wouldn't work for him. So there were ways of presenting the data that allowed him to get better access than others.
Mr. Johnson, it hardly needs saying, was the man who was making decisions that had incredibly broad impacts on the whole country. And it was critical, was it not, that he did understand the advice that he was being given?
Yes.
We've been talking so far about the need to repeat advice sometimes, or to, as you say, use particular techniques or tags to help him understand matters. Was it ever the case that you had the impression that despite repeating things or despite explaining things in a particular way, he actually had completely misunderstood some of the advice that you'd given him?
It's possible, but I think certainly when I left a meeting, I would usually be persuaded that we had got him to understand what it was we were trying to say. But as one of the extracts showed that you put up there, that 6 hours later he might not have remembered what was in that presentation. So I can't be sure that he kept it in his mind all the time as he was going into whatever the subsequent meetings were that designed policy. I would also say that I think, and I don't know, you'd obviously have to ask him, but I think he does have a technique of almost deliberately going to sort of a misunderstanding just to check that somebody isn't in a different position, and that was something he would use from time to time. But I think there was a problem in scientific understanding, and it's not unusual amongst leaders in Western democracies.
And he wouldn't be the only person who struggles with graphs. I confess to struggling with graphs myself on occasion.
Let me just show you a couple more entries, Sir Patrick, just to try and gauge the issue here. First of all, can we look at page 163, please? So we're in September 2020 now. There's a reference to the Chief Constable saying the rules are too complex. That's the subject of different evidence we've heard. But then this, PM looking glum. Then suddenly, and I take it this is a quote from him, is the whole thing a mirage? The curves just follow a natural pattern despite what you do. Incredulity in the room. The whole meeting carefully manages the PM. Is it always like this? Is that an example perhaps of him just being provocative, or did that demonstrate just a fundamental misunderstanding?
It was a point that he raised on several occasions, and he would look at the peaks of waves of infection and ask, are the interventions we're making doing that, or is this what would have happened anyway? And he did come back to that point often, and we talked him through what the evidence was that the interventions had made the difference. And of course, it is true that at some point the peak will come down, because at some point public behaviour changes, the number of susceptible people changes, the amount of immunity in the population changes. They do go up and down, but the point was that clearly these were being manipulated down by interventions.
Just before we leave this entry, you see the last sentence there, and notes that we're now in September. CMO still keeps offering a slightly slower path. We've talked already about the caution that Sir Chris had in March. It looks as though you're recording a similar issue later in the year. Was it something that continued?
Well, I think the point in brackets is important. I think this is wrong, and said it. And Chris and I discuss this sort of thing often. I still think that he, as the Chief Medical Officer with a public health accountability, was right to raise the problems associated with the measures being taken. And that appropriate caution, I think, was useful. And it was very helpful for the two of us to be able to discuss that and understand why we were in positions of either greater or slower pace on some of these things. I think it's appropriate.
One more of these references, please, page 190. So it's very much the same time, September of 2020. You record that the Prime Minister had come back from the Battle of Britain Memorial Service, was distressed by seeing everyone in masks, and then this starts challenging numbers and questioning whether they really translate into deaths. Says it's not exponential, etc., etc. Looked broken, head in hands a lot. Is it because of the great libertarian nation we are that it spreads so much? Maybe we're licked as a species. We're too shit to get our act together. He doesn't seem to have been the easiest of decision makers for you to provide scientific advice to, Sir Patrick.
It was difficult. at times, and this is an example of where I suspect in this meeting I would not have tried to get across too many scientific concepts. Would have waited for a better opportunity to do so and to have spoken to some others.
As you mentioned at the outset, you had worked with other decision makers, Mrs. May. Was this reception of scientific advice that you were providing something you were used to, or was it out of your experience?
Well, Boris Johnson and Dominic Cummings were extremely keen to get scientific advice. So they had I would say, a disproportionate interest in getting science advice. But as you can see, it wasn't always easy to provide it in a way that was understood and actionable by the Prime Minister. And I doubt that the sorts of things described in here are terribly surprising to most people.
Just before we leave this, I want to add in one extra factor, which is, of course, we know the Prime Minister was unwell for some period, sort of March, April time in 2020, that the extracts I've shown you do have some in that period, but as we've seen also later. Is that a factor that we need to bear in mind with all this?
I think there was a period, and I described that, when I think he was really unwell and was unable to concentrate on things. When he came back, he eased himself back into things over a few weeks, and thereafter I think there was no obvious change between him and what he was like beforehand.
Yeah. Thank you. I'd like to move on to a separate subject, please, and that is, in the first instance, about SPI-B, the behavioural science subgroup of SAGE. And perhaps we can start by looking at the SAGE minutes, which record the decision to set up that group. As we can see, it was SAGE 7 on the 13th of February. If we go over to the next page, we can see that you were there. I don't know, did you in fact attend every SAGE meeting during this period?
I think I missed one.
Right, not this one.
Not this one.
And if we go on to page 4, please, we see the section of the minutes headed Behavioural Science. And this was a summary, was it not, of the discussions which led to the decision that a behavioural science subgroup would be a good idea. And then we've heard from Professor Rubin the way in which it was set up. I wanted to draw your attention to one feature of these paragraphs without reading them all out, which is that there is a repeated reference within them to messaging. Do you see that? I haven't actually counted, but most of these paragraphs refer to importance of messaging and the link with behavioural science. Is it a fair understanding, then, of these paragraphs that part of the purpose of setting up SPI-B was to assist with the exercise of providing the public with appropriate messaging during the pandemic?
Part of the reason for having behavioural scientists there, and by the way, I think James Rubin and Brooke Rogers, who were at this meeting, absolutely exceptional, was to make sure that the principles underlying messaging were understood. So it wasn't to design the messaging, it was to make sure that principles like collective ownership of things was important, like don't drive fear as the messaging vehicle, and those sorts of things were important messages. And SPI-B produced some really important papers on that. It's because of that around this time I introduced James Rubin and Brooke to both Dominic Cummings and to Alex Aitken, who was the head of government communications, to make sure that there was a vehicle for them to feed in their principles of messaging.
Yes. This is really what I wanted to explore, Sir Patrick, because on the one hand, as we've said, we see great emphasis being placed on messaging. On the other hand, we asked Professor Rubin about the fact that the forerunner to SPI-B, which had been set up during the swine flu pandemic, was called SPI-B and C, the C standing for communications. And I asked him whether the lack of a C this time round was accidental. He said no, there was a deliberate decision taken that we weren't to be involved in communications. And it's fair to say, isn't it, that there is if you like, an inconsistency there to have on the one hand a committee which was at least one of its main purposes to be involved with developing messaging, and on the other hand to be told, but you're not having anything to do with communications. Is that a fair point?
I'm not sure it is, actually, because the point that the behavioural scientists are trying to give is the principles behind messaging, not the actual construct of the communications. And I think that distinction is quite important. This is behavioural science advice into communications and messaging, beyond communications, messaging more generally. That link's an important one, and I think the ownership, though, of the actual communications had to be within Public Health England, within the public health system, within government communications. And where SPI-B could help was making sure that the principles were clear, and indeed, on occasions, I think they were brought in to help with specific messaging as well as individuals. But I don't think maybe I'm wrong, but I don't think it would be appropriate to have an academic group designing government communications.
Well, I don't want to overstate this. Of course, one can see that in principle, providing the academic sort of direction is one thing, and designing the communications themselves is a different thing. But the evidence we heard from Professor Rubin and also Professor Yardley was that how it worked out was that, yes, they did the behavioural science work, but they couldn't see that being taken into account at all in the communications strategies. And in fact, they disagreed sometimes quite strongly with several of the main strategies that were rolled out. And I think when we spoke to Lee Kane, he said, well, I really paid more attention to my focus groups than what the behavioural scientists were telling me. So perhaps in principle, the division you describe is sustainable, but in practice, it didn't work, did it?
Well, I think it's exactly the same as science advice and ministerial decision-making. And so I think SPI-B gave very good advice on this. We introduced them to Alex Aitken, to Dominic Cummings, to others. The fact that the government then chose to do things that were different from that, provided they've understood that the input has come, provided they've heard it properly, that is a ministerial decision to do things differently. I mean, I happen to think that they could have listened more to SPI-B on this for sure, and that would have been helpful. But it seems to me that's exactly where ministerial accountability comes in decision making. It's the same for this area of science as other areas of science, and it, maybe to put it even more boldly, following the behavioural science would have been as bad as following the science.
Are there, though, lessons to be learned for next time? I'm accepting your point that ultimately it's for politicians and their teams to either accept or reject advice they're given. It can't have been. It can't be regarded as a positive, can it? That the evidence we have heard is that one had a group of behavioural scientists suggesting one thing, and a group of communications people in Number 10 essentially ignoring them and getting on and doing their own thing. I mean, that can't be regarded as having been a successful outcome. No. Are there lessons to be learned for next time?
I think there are lessons to be learned. One of the lessons which is important is to get the advice and the papers out quickly in the public domain, because then it's very obvious when ministerial decisions are deviating from that advice. Ideally, you'd like to know what other advice they'd received that meant that they'd gone down a different route. And you said that Lee Kane suggested it was focus group advice that he wanted to pay attention to. Again, that seems to me to be a decision that is one that the ministers and their officials can follow. But I agree with you that the advice from behavioural science needs to be prominent, clear and accessible to everybody. And it wasn't a good outcome that some of these things were ignored.
Let me move on and in fact pick up that theme. One of the solutions, or the solution you have suggested, is transparency, which echoes an approach you took with SAGE, which we'll come to. But it may be that some of the documents suggest that precisely one of the problems with SPI-B, and perhaps more broadly, was with scientists expressing their views publicly. And if we look, for example, back at the schedule of your notes on page 50, you say we're in May 2020. SPI-B had to calm them down about the role of advice versus decisions. So that, to that extent, clearly a division you've already explained. Immediately after another article in The Guardian with quotes from people and SPI-B disgraceful. So if part of the solution you're suggesting is that SPI-B's views should be made public, why was it disgraceful that they were doing that?
This wasn't a SPI-B, it was individuals in SPI-B. And one of the problems that I think did occur was a very, very small number of people, 1, 2 or 3, made policy judgments very visible in the press, and statements on existing and planned policy, including on occasions even discussions that have taken place in SPI-B in the press. That had the effect of undermining SPI-B, and it undermined trust in SPI-B from within government. And my understanding from discussions with James Rubin and Brooke was that it also undermined the way that SPI-B worked sometimes, because people were concerned about expressing their views for fear that that was then going to appear in a newspaper. So I think there was, and this is my personal judgment, there was too much policy, too much commentary on things that even weren't behavioural science sometimes, on other aspects, and too many individuals who didn't distinguish between them as an individual and them as SPI-B and SAGE. And by the way, they might have done that themselves, but it was not how it was ultimately portrayed. And I think it's very difficult to run a government advisory committee if things are perpetually being discussed in the press.
Can I ask you about a different document, but it touches on the same issue, but this time in relation to SAGE itself rather than SPI-B. So this is 232074, please. So this is, if we have the bottom half, this is a Treasury email which summarises a SAGE meeting. It's a readout. And we see the first bullet point there. We don't need to go back, but we can see that the date was April 2020. It says Valens started the meeting by highlighting he'd seen several reports in the media of SAGE members commenting on the science behind the government's approach. He highlighted that this wasn't helpful and said that no one should be speaking to the media. Again, of course, scientists were independent, and in that sense, they had a right to speak to the media. But was this something, to go back to your point about SPI-B, which increases transparency and makes it easier for the government to be held to account? Or, as you're suggesting here, was it something that undermined the advice function itself and therefore ought to be discouraged or even prohibited?
Well, I'm going to take issue with the minute, because the chair's brief and indeed the repeated commentary that I made at SAGE was any of you can speak to your own topic, your own expertise in the press, and should feel free to do so. So actually we had a very open policy to people speaking to the press about their own areas of expertise. We asked that people didn't comment on policy, because that then would confound the SAGE remit with their policy views. And we asked that they tried not to stray into areas that were not their area of expertise, because that inevitably would reflect back on SAGE. And we asked that they didn't report the discussions that were taking place in the meetings, because the minutes wouldn't have come out by that stage. So that's what the restriction was. It was absolutely not that people couldn't speak to the media. And if you ask Fiona Fox from the Science Media Centre, she would say there's been more scientists from government committees out speaking about their expertise and trying to help the media understand in this pandemic than we've ever seen before. So I think we actually actively encouraged where it was appropriate for people to go and speak about their own areas of expertise, but not policy.
So I think you're telling us that that is not an accurate summary of what you would have said.
Yes.
There's more nuance to it than
Yes.
that, and that's what you've just given us.
Yes.
With that nuance, is it your reflection that that was the best way of dealing with this issue of how scientists should speak publicly without being able to stop them completely?
Well, I don't know if it was the best. I mean, there may be better ways of doing it. I did know that it was very, very difficult when scientists spoke about policy and other areas because it then undermined trust in the committees, and we saw that later in the pandemic with some departments and some ministers saying, I won't bring something to SAGE because it's just going to leak and people will talk about it. And I know that, again, the Science Media Centre felt that we got it about right. So I'm not sure what more could be done here. I definitely believe that people should be free to speak about their own areas. And I also believe that it's very difficult for a government committee to operate if people are apparently reporting government advisory views in the press outside the formal mechanisms. It becomes really difficult to build the trust that's required to get influence inside government.
Thank you. Let me just move. We're sticking with SPI B, but to a related issue, and that is not so much them commenting publicly, but several of them joining independent SAGE. And for these purposes, perhaps we can look at some email exchanges between you and Stuart Wainwright. First of all, can we please look at 197131? And here, just excuse me a moment. Yes, so if we look towards the So I think if we can go on to the next page, please. Yes, we see at the top there an email from Stuart Wainwright. It's an exchange at this point between him and James Rubin. And you can see that they are discussing the fact that I think at that stage a small number of members of SPI B had joined iSAGE, independent SAGE that is, and Mr. Wainwright says it raises real issues of trust for policymakers in HMG in the ability to bring things to the committee as a, quotes, safe space. Do you see that? And then if we can please look at the email immediately before that, so perhaps back to the next page. You can see Professor Rubin, rather, saying that DHSC will presumably want us to adopt nerve tag style membership arrangements, and I think that's the appropriate time for a refreshed set of terms of reference. And then just before I ask you about this, if we can look at a subsequent email, this time it did involve you, 196969. We see an email 2/3 of the way down from you to Mr. Professor Rubin. James, the effect is that government departments are now becoming very wary of putting anything to SPI B because of a risk of leaks or misuse. We should think about how to deal with it. It's bizarre behaviour. And just for context, by this stage, rather more members of SPI B had joined independent SAGE. So a related problem, Sir Patrick, is what we see here, in effect, a chilling effect, that HMG becomes less willing to ask questions of SPI B because, in this instance, of a concern about whether that information will simply be passed to independent SAGE.
Yes, I think that is what was happening. There were confidential papers that came to SPI B and to SAGE, and it was important that people who put those papers in knew that they weren't going to disappear somewhere else. and it was important that the outputs of those committees came to ministers with a chance for them to reflect upon them before it was widely articulated elsewhere. And I think I'm second to none in my belief of academic freedom, but if you join a government committee, it's slightly odd to then be on a committee that's set up to challenge the government committee. It doesn't seem quite right to me. And I think Kamlesh Kunti, when he gave his evidence, was very good on this and said that independent sage was very often focused on policy rather than science advice. And that seemed like quite a big worry, that we'd end up with a sort of policy advice organisation with direct links to some of the papers that had come confidentially to Spy B. So I was worried about it, and there are some examples where there was a chilling effect, where people didn't want to bring things to either SAGE or to subcommittees as a result of either this or indeed the transparency of publishing all of our minutes and papers.
Yes. And again, looking forward and thinking about how, as we stand now, some of these committees have been disbanded, some others are getting on with their work, but of course in an environment which is completely different. There isn't the blaze of publicity. We don't hear scientists debating these issues in the press all the time. But as you have said, there will be another pandemic, and we can imagine that similar circumstances might well arise. What have we learned from this experience? Are there ways of controlling what scientists do? And there was a reference to the nerve tag arrangements. Are those different? And is that a blueprint for the future?
I don't know exactly what the nerve tag arrangements were, but we've definitely, as part of the SAGE development programme, developed guidelines on what you should and shouldn't do in terms of speaking to the press. And it's the rules that I've just said: speak about your own area, please do. That's helpful to inform, but don't go outside that. And about membership of other organisations, that it needs to be declared up front, and there needs to be a discussion with the chair before it's agreed whether that's appropriate or inappropriate. The difficulty here was it just happened without anyone knowing about it, and then it became public, and it became very difficult to deal with.
Thank you. Let me move on, although sticking with this theme of transparency, because as you've said, I mean, you talk in your witness statement about SAGE transparency. In particular, we know that at the outset of the pandemic, SAGE minutes, indeed attendees of SAGE, was not something that was published, and this was something that you took on yourself, and after a few months that changed and minutes and lists of attendees were published, and you describe that step in a very positive way in your witness statement. Is this right? You regarded it as important both as a reputational matter, but also, and I think this is the context in which you raised it with Spy B, as a means of providing challenge and allowing people to understand whether the government had made appropriate decisions or not.
Yes, I think we made the decision to publish minutes in March and then did the backlog catch up by May. I do think, and this again has been put in the SAGE development plan, I think there should be a process for publishing minutes and papers as soon as is reasonable after the meeting, with some caveats, and those caveats would be national security, one, and two, if there was a need to delay things for a little bit to give ministers a chance to be able to consider policy options in advance. But I believe both the evidence for SAGE, but more widely, I believe the scientific evidence that underpins advice to departments should be made public, because that's what science does best. It puts things out there other scientists can challenge, and that creates the right external environment to actually be helpful, not on the policy, but on the evidence base. And I think that is a valuable thing, and we had to go through quite a lot to make that happen during the pandemic, including operationally. It's quite difficult to get these things done because you've got to get permissions from the authors, you've got to get them in the right format, you've got to get them up on the website, and that took a little while in a team that was very busy doing other things. It's the sort of thing that I describe in the so-called 100-day mission as getting the rules of the road sorted out in advance, so you're not trying to sort them out during a pandemic.
One can see, and you've described very well, all the advantages that flow from this policy of transparency. But there are problems that come with it, are there not? And one of them is the problem we've just been discussing in the context of SPI B, which is a chilling effect. And if we look at your notes, well, I will ask you, but at least on the face of it, it seems that this policy of transparency did indeed create this type of chilling effect with SAGE itself during the pandemic. If we can go, please, to the schedule and look at, I think it's 3 references. Thank you. First of all, this one. We're in June 2020, and you write, you refer to a paper from number 10. You say someone has completely rewritten it. They've just cherry-picked, quite extraordinary. And then, for our purposes here, note apparently Simon Case, I'm afraid I can't now remember whether at that point he had, no, he wasn't, he was a permanent secretary within the Cabinet Office at that point. He hadn't become the Cabinet Secretary. Simon Case said, don't bring new schools advice questions to SAGE as the minutes get published. If we can move on to page 102. Another note, Secretary of State for Education says, don't ask SAGE as minutes get published. And then moving forward a few months, both of those references were in June. If we can move forward to page 253, please, we're in October. On a similar theme, apparently the Cabinet Office, so not the Department for Education, but the Cabinet Office, now cautious about putting things to SAGE because we publish it all. That's a very bad outcome. Well, it is a bad outcome, Sir Patrick, and I just want to ask for your reflections on where the balance is. I mean, it's for all the reasons you've given, there's a lot to be said for publishing the minutes. But on the other hand, if the consequence of publishing the minutes of an advisory body is that its customers don't come to it for advice anymore,
yeah.
Isn't that something of a at least mixed situation?
If I may just, on the very first one you read out about somebody rewriting the science, that was an internal paper in Cabinet Office, and that rewrite never went anywhere. Right. So that I think is not. But this is a very important question, and there is no doubt that DFE took this view at times, and Cabinet Office, there was an alarm that might happen. I don't think in the end it stopped us doing anything on schools that we wanted to do, but it did mean we sometimes didn't get precise questions. I do think it's a problem, and I don't know what the answer to it is, but I believe there is a cultural issue which can be overcome, which is the more the principle is accepted that the evidence is published, not the advice, not the policy position, but the evidence is published, the better government decision-making would be. And the more that happens during normal time, as well as during emergencies like this, the more it will become a culturally accepted and reasonable thing. There is a fear sometimes that if the evidence is out there, it's going to force a minister's hand. And as I said, I do think you need to give ministers time to do things before it becomes public. But my approach has been, and I've had this discussion during peacetime in government as well as during the pandemic, is the evidence itself can neither be harmful nor beneficial. It is just what it is. And provided all of the evidence is published, ministerial decision can be completely free to overturn that evidence and say, I choose to do something different. So it is a worry, and it was a concern, particularly during this period. But I don't think the answer is to reach for more redaction or more secrecy around this. I think it's to get into a normalised position where evidence publication is seen as the right route.
Sir Patrick, you emphasise evidence in contrast to advice. But what we've seen in these extracts is a concern, in this case emanating from the Department for Education, about SAGE minutes being published. Surely those minutes contain advice?
The minutes usually are containing evidence and have it couched in terms of if the aim is to do X, then the following would be necessary. Or given the state of the pandemic at the moment, without a decrease, it's likely to lead to the following situations. is usually not the case that it's giving direct advice on precisely what the science is suggesting a minister should do.
Patrick, we don't want to split hairs about this, but thinking about the practical situation that, in this case, the Department for Education seemed to have been in, the thought process appears to be, we have this policy that we're considering, why don't we ask SAGE about it? One reason not to ask them about it is that if we do, their minutes will record their discussion, and you can call it evidence if you like, but anyone reading it will see, if this is the view they took, that they think it's a bad idea. And that will mean that if we go ahead with it, people will criticise us. I mean, that's the problem, isn't it?
It is the problem. And again, I think the more you focus on evidence rather than advice, the easier it is. It is a problem. I don't know what the answer to it is. My instinct is that greater transparency is helpful all round. And my experience from the pandemic was that in the end, none of these came to be a problem. In other words, DFE did try and not bring things to SAGE. We overcame that, and they did in the end bring them, and we also did work on it. So they were bumps in the road, they weren't blocks. And I think Stuart Wainwright laid these sort of pros and cons out very nicely in his evidence. I would not wish to see less transparency of the science evidence.
Let me ask you briefly, if I can, about a similar but slightly different issue. Here we're discussing the question of whether SAGE were asked at all about issues. There's another issue which emerges from the notes where SAGE were asked, but their advice was either ignored or even apparently attempts made to change their advice. Can we look at some entries in your schedule, please? First of all, page 56. So here we have your comment that we've been excluded from the PM's strategy meeting. Chris Whitty, no doubt, is sure that it's because the Economic Secretariat in the Cabinet Office want to be able to present things about reopening without us contradicting them. So perhaps that's, in fact, a little like the other ones we were looking at. Page 94, please. The 2 metre rule meeting made it abundantly clear that no one in number 10 or the Cabinet Office had really read or taken time to understand the science advice. Quite extraordinary. Page 98, please. Number 10 pushing hard on releasing measures. They're pushing very hard, and then this. And want the science altered. We need to hold on to our hats. There will likely be a second peak. And then lastly, page 112. In the economics meeting earlier in the day, they didn't realise CMO was there, and the Chancellor said, it's all about handling the scientists, not handling the virus. They then got flustered when he chipped in. So a collection of entries, all of them, to be clear, in terms of date, around sort of May, June, July, reopening in 2020. The common theme is that either SAGE is being ignored, or it's not being asked, or even a suggestion that the SAGE scientists should be handled in some way, or that their advice should be altered. Help us, was there a feeling, perhaps particularly at that time, that perhaps you weren't being asked for your advice in good faith?
I think there were definitely periods when it was clear that the unwelcome advice we were giving was, as expected, not loved. And that meant we had to work doubly hard to make sure that the science, evidence and advice was being properly heard. Now, it doesn't surprise me that there were meetings that we were not included in. That's normal. We were, as I said, in number 10 probably for 45 minutes or an hour, and there were things going on all day and political decisions as well. So it's not surprising that we were not invited to things sometimes. And it definitely is the case that there were times when, because we were giving unpalatable evidence and advice, people would rather not hear it. And I think that probably is a normal part of politics, and our job was to make sure that we weren't in the politics. We were continuing to make that advice as heard as we could make it.
Did you, and this I now ask for your view on reflection, not writing your notes late at night, but did you feel that you were in some way being manipulated or handled, or that your advice was, people were asking you to change your advice?
Well, I don't think anyone, well, I know nobody actually got us to change our advice. I mean, the example of somebody maybe putting pressure on us to do it, we wouldn't do. And I think there's a WhatsApp exchange you've got where Matt Hancock asked me to change something, and I say, no, we're not going to change our advice, because that's where the evidence bit comes in, that you've got to at least see that, even if you disagree with it and you don't want to do it. But I'm absolutely sure, because politicians are politicians, that there were attempts to manage us and make sure that we were not always given the access that we might need. But I think overall, we actually managed to get through all of that and make sure that the advice and the evidence was heard. So I don't know what damage it did, and I'm not sure exactly what I'd recommend for the future on that, because it seems to me that's partly the nature of the way the political system seems to operate.
One thing we do know, and you state this in your evidence, is that around this time and in the period just after it, there were a series of government initiatives in respect of which Sage was not asked to provide its advice. Eat Out to Help Out in the summer of 2020, Tears, the Rule of Six, later in the year. I mean, do you know whether the type of thinking that's evidenced in these notes was part of the reason why you weren't asked about those matters?
Quite possibly. I don't know the reasons behind each of those. I mean, Eat Out to Help Out we didn't know about until it was announced, and I think our advice would have been very clear on that. I think the Tears, we were involved in some of the discussions as they started to say what they wanted to do, to try and advise on what would be sensible in different tiers if they were going to go down this route. But I don't think we were involved at the inception of that. And in some ways, nor should we be. These are policy choices, but we should at least see what the policy choice is and have a chance to comment on that. And it's one of the things that I say to chief scientific advisors in every department: you've got to make sure you're at the table for the policy discussion, rather than waiting for somebody to come to you and say, I have a bit of science question that I've got for you.
Just focusing for a moment on Eat Out to Help Out, it's evident from your witness statement that at the time you, and indeed Sage, didn't agree with that approach, or at least were alive to the risks that it brought with it. Would that be a better way of putting it?
Well, I think up until that point, the message had been very clear, which is interaction between different households and people that you weren't living with in an enclosed environment with many others was a high-risk activity. That policy completely reversed it to saying, we will pay you to go into an environment with people from other households and mix in an indoor environment for periods extended over a couple of hours or more. And that is a completely opposite public health message as a result of that. Now, it's quite likely that had an effect on transmission. In fact, it's very difficult to see how it wouldn't have had an effect on transmission, and that would have been the advice that was given had we been asked beforehand.
Yes. Well, let me just take you to your statement, if I may. It's paragraph 648, page 209. It's the last sentence or so. You say, as I've discussed, Sage, this is the point you've just made, was not asked to provide advice ahead of the Eat Out to Help Out scheme being introduced. And then you say this, but I think it would have been obvious to all involved that our advice would have been that this was likely to increase transmission of the virus. We can hold that in mind. Can we look at a paragraph of Mr. Sunak's witness statement, please? Thank you. And it's paragraph 317. And Mr. Sunak says, throughout the period at which Eat Out to Help Out was in operation and immediately prior to its implementation, I don't recall any concerns about the scheme being expressed during ministerial discussions, including those attended by the CMO and, no doubt, he means the GCSA. That's you. There's a certain inconsistency between your statement where you say that you think that it would have been apparent to everyone that you opposed it, and Mr. Sunak's statement where he says that you never objected to it.
Well, we didn't see it before it was announced. I think others in the Cabinet Office have also said they didn't see it before it was formulated as a policy. So we weren't involved in the run-up to it. And around that time, lots of measures were being released, and you'll see repeated references in various minutes and notes and emails, and indeed, I'm sure in my private notes, to our concern that people were piling on more and more things, and that this would come to drive R above 1. And I think that was discussed at Cabinet as well, that was the concern we had. So I think it would have been very obvious to anyone that this was likely to cause inevitably would cause an increase in transmission risk. And I think that would have been known by ministers.
And Mr. Sunak?
If he was in the meetings, I can't recall which meetings he was in, but I'd be very surprised if any minister didn't understand that these openings carried risk.
Yes, thank you, Mr. Patrick. Maybe I'm about to move on to another topic. Yes.
Certainly, Mr. Brennan. 2 o'clock, please.
All rise.